When people think about congenital heart disease, everyone thinks about the surgeon, but the surgeon is just one piece of an entire ecosystem that really has to be there in order to provide the best care for the patients. From the diagnosis, you have cardiologists, you have the anesthesiologists that are going to be there, the perfusionists that are running the pump, the nursing team, the intensivist, the advanced practice providers, the social workers, the psychologists. If one of those elements, if one of those pillars is not excellent, the entire care of the patient is not optimal, no matter how good the surgeon is. So that's something that I always tell patients and families when they're looking at where to go get their care. They have to look beyond the surgeon. They have to look at the entire system. Is the system an excellent system? Is the program an excellent program? And what are the outcomes of the program? And is every element of the program able to care for their child in the best way possible? If you actually look at what are the best centers and the centers that provide the best clinical care, they're always associated to an academic center. And that's by design. I mean, you basically have learners that are questioning you. And I think that sense of inquiry and accountability makes you and the program in general be better and look for ways to advance the field. I think that's the reason why an academic center just makes a huge difference in terms of the progression of the field and that strive for excellence. In the 1950s, there was no cardiac surgery. We didn't have the ability to put someone on the heart-lung machine and really operate on the heart. Over the last few decades, the field has just exploded overall. And even some of the problems that we address now, some of these children 20 or 30 years ago, they didn't have an option. The number of advances that have happened in our field in particular over the last 20, 30 years have been just amazing. And not only on the surgical field, but also in the way that we care for patients, which allows us to give these children the benefit of a life.